Welcome back to AI in 5. I'm your host, Simon Chris, and joining me today is Dr. Stefan Verhagen. Stefan is a neurologist and runs a company called Brain Vector, and we're going to be talking about algorithm-based therapy for mental health. Hey, Stefan, welcome to AI in 5. Thanks for joining us.
Thank you, Simon, for inviting me.
This is a great topic. I can't wait to get into this one with you because we talked about it before. But using AI to improve mental health. I mean, there's a lot of anti-AI out there. AI is bad. This is a fantastic example of AI for good. Tell us a little bit about the work that you're doing.
Yes. So I'm a neurologist by background, and I discovered by my study and by my readings that there is a very direct link between your positive memories, your emotion, and your mood. Could be high mood, happiness, but also sadness or anxiety.
Right.
So I try actually to reactivate your positive memories, induce a boost of positive emotion that, you feel the goosebump and things like this type of emotion. And actually this emotion in your brain release neurotransmitters like serotonin, dopamine that are the good feeling neurotransmitters. How to activate these memories. And that's why, that's how and where AI entering in the dance floor is that in order to reactivate these memories, you need to ask the patient or the person, tell me about your memories. What makes you feel this good? And they talk about their parents, the dad, or the brother and things. But sometimes we have an example that we have a patient that his brother is living far away in US, and sometimes he can't talk with his brother. And then he says, sometimes my brother, I want him to say me something good things, but my brother has his own life and he has his own feelings. So then we use AI. We just take a passport photo of the brother, just a little few seconds of the voice message that everyone has his phone, and we transform that with AI in a very intense and positive experience.
And is this something that people are accessing through their phone or screen, or is it virtual reality, or how do you do it?
It's we need virtual reality or something very immersive. Because the brain loves to be distracted.
Yep.
So in order to activate this brain, we need to put this brain exactly in front of the screen and with headset to focus what the person is watching and hearing. So yes, it is more in virtual reality. We tested that a few times and the results were absolutely amazing. Really. And then when I showed that to different scientists and people, they were very impressed at how we can with AI, just with a little passport photo and few data, how we can transform that in a real experience. So it's very impactful. And now we are at the beginning, and we do clinical trials. We're testing with athletes and sports people in order to how we can use that also for mental performance.
So it's not just mental health for people, say, with anxiety and depression, but it's also being used on the positive side to enhance performance?
Yes, exactly. We tested with an Olympian just back from Paris, and he didn't reach the results he wanted to achieve.
Okay.
And after the exposure to our technology, he said, it is the first time since Paris that I feel the need that I want to go back in training.
Wow.
So, yes. So it was very, very positive. So we are very excited, and I'm so happy to show and tell you and everyone that AI is not a bad thing if it's in the good hand. And having AI accessible in a medical setting, it's amazing. It's amazing.
Yeah. And I imagine you can use it to reach scale, right?
Yes, this is the one. This is exactly that. I tried this concept since 2019, but using VR, but I needed coding and it cost thousands of dollars to do that. Now with AI, it's much more accessible for us. We develop a emotion AI system in our company, and this system is able actually to play with the image and bring the emotion that we want to achieve.
Wow. And what's the most surprising result that you've had so far, or the most mind-blowing result?
Yeah, it was actually our first test when the subject said, "Wow, it is like an injection of a drug." He said, I'm so euphoric after that.
Wow.
It's so intense. So we are very surprised how intense it is, and also very interesting. The subject said, I knew after 10 seconds that the first 10 seconds I knew it was not my brother. It was because AI is not perfect.
Yeah.
But because it was so personalized and so meaningful that my brain was tricked, and then I totally entering and was totally absorbed by what my AI brother was saying.
Incredible. Incredible. We're right at time, but I love to ask everyone the same question, which is if an organization is just kind of getting into the world of AI, what should they be thinking about? What's one thing they could focus on?
I think it's having a clear vision of what you want to achieve, and AI is not would say it's in enhancing your vision, your idea. It's not the idea. AI is not an idea. You need to have a vision, see how you want to achieve, and AI is enabling, is enhancing what you want to achieve. It's a tool. It's an amazing tool. Just
fantastic. Awesome. Awesome. Great episode of AI in 5. We'll definitely keep an eye on your work going forward, but thanks for being on the show.
Pleasure, Simon. Thank you for inviting me.